In this video, you will learn about the procedural steps for performing venipuncture, including the equipment required. This is an NHS Highland Practice Development Skills video adapted for UHI use. This video is designed to be used by student nurses in conjunction with a practical teaching session and directed reading. It can also be used as a reusable learning unit to refresh your knowledge and skills. UHI skills training attendance and competency assessment must be completed before performing this skill, and students should make themselves familiar with the relevant NHS Highland skills policy, which can be found in the policies library on the NHS intranet site. Before approaching the patient, perform hand hygiene. Introduce yourself to the patient, explain the procedure including risks and benefits, gain verbal consent, check allergy status and support the chosen arm on a pillow.
Equipment required: wipeable tray, disposable tourniquet, chloroprep, gauze swab or cotton wool, Monovet needle or butterfly needle, Monovet adapter, blood tubes, blood forms and a sharp spin. Apply tourniquet for no longer than 2 minutes. Select appropriate vein, then release tourniquet. Perform hand hygiene. Disinfect your wipeable tray for ANTT using detergent wipes and allow to dry. Assemble equipment for venipuncture using ANTT, ensuring not to touch key parts. Choose appropriate device dependent on vein selection. For example, a needle or butterfly needle. Perform hand hygiene. Clean the chosen site with chloroprep using up and down and backward and forward strokes for 15 to 30 seconds and then allow to dry. Do not repalpate vein once clean. Apply tourniquet for no longer than 2 minutes, making sure not to contaminate the skin you have cleaned. Apply non-sterile gloves. Remove the cover from the needle and inspect device carefully. Anchor the vein using skin traction a few centimetres below the site. Insert the needle, bevel up, at an angle of approximately 30 degrees or below. The angle will depend on the depth and the size of the vein. Reduce the angle of the needle as soon as flashback of blood is seen or when puncture of the vein is felt. Slightly advance the needle if possible. Do not exert any pressure on the needle. Withdraw the required amount of blood using the appropriate blood collection system, ensuring the correct order of draw. Gently invert the tube. Release tourniquet and unattach the last blood tube. Gently inverted as guided in the manufacturer's instructions. Place a low linting swab over the puncture point. Remove the needle. Do not apply pressure until the needle has been fully removed. activate the needle safety device and discard the needle immediately into the sharps bin. Apply pressure directly over the puncture site until bleeding has ceased for approximately 1 minute. Label the bottles with the relevant details at the patient's bedside. Never pre-label the bottles. Apply adhesive plaster or alternative dressing if needed. Dispose of waste and decontaminate hands. If using the wing device, proceed with venipuncture as previously shown, holding the coloured wings together, inserting the needle bevel up. As this device is used for smaller veins, the insertion angle will need to be lower, at approximately 10 degrees. When removing the needle after blood has been obtained, for a one-handed activation of the needle protector in the vein, secure the tubing with your fingers and slide the needle protector forward with your thumb and index finger. The needle protector will lock notably. It is recommended by the manufacturer to withdraw the first blood sample using aspiration technique as shown in this video. Additional samples can then be collected using the vacuum technique. To pre-vacuum additional blood tubes, pull down on the plunger until an audible click can be heard, and then snap off the plunger. Please ensure that appropriate PPE is worn when carrying out all clinical skills, including aprons. Aprons have not been worn during the making of these skills videos to reduce noise interference.